Hi, my name is Patty Gonzalez, and I'm going to perform a musculoskeletal and neurological assessment. So first I would wash my hands. I would identify myself. Hi, my name is Patty. I'm the nurse. I will be doing your assessment today. And I would ask him for his name and date of birth, which he told me. Check his ID, and he is the correct patient. First, I'm going to assess for any skin abnormalities that he might have. So I'm going to assess his skin. Are you having any issues with your skin? So the next thing that I'm going to do is I'm going to ask the patient to stand. He may stand. And I'm going to check for symmetry in his shoulders, arms, and his legs. So the first thing I'm going to do is test his range of motion in his shoulders. Sir, I'm going to ask you to please move your arms straight up, high above your head. Okay, you can put them down next to your side. Now behind your back. Okay, you can put them down by your side. Now I'm going to have you raise your arms and touch your fingers. Now you can place your hands behind your head. Okay, now you can put your arms down. Now I'm going to assess his range of motion in his arms and hands. So I'm going to ask you to bend at the elbow your left arm. You can put it down. The same with the right. You can put it down. Now I'm going to ask you to flex and extend your right wrist. Okay, you can put that down. Now your left one. You can put it down. Now go ahead and extend your fingers in your right hand. Okay, you put it down. Now in your left hand. Okay, you can put that down. Now the next thing that I'm going to do is assess for his strength against resistance, his arm strength. So I'm going to have you stand like this. Now go ahead and extend your arm. Okay? Now go ahead and move your arm close to you. Okay? Extend your arm. Now close to your body. Okay. Now I'm going to go ahead and do the same with his wrist. So go ahead and push down. So same thing with this one. Down. Up. Okay. Now the next thing that I'm going to do is I'm going to assess his spine to make sure there's no, for any curvature that's going on. So I'm going to have the patient, you can stand like this. So I'm going to ask you to bend at the waist, all the way down, a little bit further. I want to assess his spine to make sure that it's nice and straight. Okay, you can go ahead and stand. Now you can go ahead and turn around and look at me. Alright, now I'm going to have you put your hands on your waist, and I'm going to ask you to bend backwards. Now you can bend, you can stand normal. Now I'm going to ask you to go side to side. Okay. Now you can rotate your shoulders to one side without moving your legs. Okay. Now I'm going to ask you to, I'm going to assess his gait to see how his walking is. So sir, I'm going to ask you to turn towards the wall. You can put your arms down. I'm going to have you take a few steps forward, heel to toe. Now I'm gonna ask you to take a few steps back on your tiptoes. Okay, you can stop. Now I'm gonna ask you to do the same on your heels. Okay, that's good. And then I'm gonna ask you to bend, you can stand, bend slightly at the knees, and then stand up straight. Good. Now the next thing I'm gonna move on to is the neurological assessment. You can have a seat. So I'm going to ask him a few questions to test if he knows, test his orientation, his alertness and orientation. Sir, can you tell me your name?
Alvin Gonzalez.
And do you know where you're at?
Yes, my house.
And do you know what time it is?
Yes, it's around 9 o'clock right now.
Okay, and what are we doing for you at this moment?
An assessment, physical assessment.
Okay. So now I'm going to move on to the cranial nerve assessment. Now I'm going to have you close your eyes. I'm going to ask you to identify what you are about to smell. Can you tell me what the smell is?
It's gum. It's a gum. It's spearmint gum.
Okay, you can open your eyes. Now the next, that was the first cranial nerve, the olfactory. The next cranial nerve that I'm going to assess is the optic nerve. Now with this one, I am going to do the confrontation test. So I'm going to ask you to cover your right eye. Okay. Now I'm going to go ahead, when you see my finger coming close to you, I'm going to ask you to say yes.
Yes. Yes. Yes. Yes.
Okay, I'm going to ask you to cover your left eye. And the same thing, just keep looking at me.
Yes. Yes. Yes.
Okay? Now for the testing or the assessing of the fundus, I would have an ophthalmoscope, but I don't have one. So for that, I could dim the lights. I would use my ophthalmoscope and assess the right eye, assess the left eye, and looking at the fundus. So the third cranial nerve is the ocular motor. Third, fourth, and fifth is ocular motor, trochlear, and abducens. And I'm going to ask him to do the 6 cardinal fields of gaze. So you are going to look at me, but I want you to follow my pen light with just your eyes. Do not move your head. Follow it with just your eyes. Okay? And I'm going to check for direct and consensual pupillary reflexes. So first I'm going to shine the pen light to his left eye. Sir, just look at me. Now the right one. Okay, now I'm going to test to see if they both constrict when one is shined in one eye. Okay. Now I'm going to test for convergence. So sir, I want you to keep your eye on my pen light. And as you as it gets too close, you let me know, okay? Focus on that.
It's close.
Okay, focus on my pen light. Keep looking at it, keep looking at it. Okay? Now the next thing I'm going to do is for accommodation. So I'm gonna ask you to look at that blind. Okay, now I want you to look at this. The blind. Now this. Okay. So the next cranial nerve is a trigeminal. And I'm gonna ask the patient to clench his teeth. So you're going to clench your teeth. Okay. Alright, so I'm gonna have you close your eyes. And I'm going to run this soft cotton on his face, but he's going to tell me where he feels it. Keep your eyes closed. Where do you feel that?
Forehead. Right cheek. Left cheek.
Okay. He stated all those correctly. Now the next cranial nerve is cranial nerve 7. Now I'm going to ask, you can open your eyes. I'm going to ask you to raise your eyebrows. Okay, you can lower them. I'm going to ask you to puff out your cheeks. Okay. Cranial nerve 8 is the vestibulocochlear. Now I'm going to stand behind the patient and I'm going to whisper something in his left ear, and he is going to repeat what I asked him, or what I told him.
How are you? What time is it?
And he answered correctly. And now for cranial nerve 9 and 10. I'm going to have the patient, so I'm going to have you stick out your tongue. A little bit more, all the way, okay, you can put it back in. And also, he's going to stick out his tongue again. I'm going to look in his uvula, and I'm going to have him say ah, to see some vibration in the uvula. Or for if the uvula rises. So I want to open your mouth, stick out your tongue, say ah, okay? Alright, so not vibration, it's phonation, sorry. So now cranial nerve 11. I'm going to have the patient to rotate his head from side to side. So, no, not yet. So go ahead and rotate it to your left. Okay, now you can relax. Rotate it to your right. No, bend to the side. Again, to the side. Okay, now relax. Now to the right. Okay, relax. Alright, now I'm going to have you shrug your shoulders, so you're going to go like that, but I want you to do it with me trying to resist. Okay? Good. Now the next thing that I'm going to do is I'm going to assess cerebral function with the Romberg test. So sir, I'm going to ask you to stand up. going to have you stand this way. And then what I would like for you to do is have your arms and legs together. Close your eyes, and you're going to remain in this position for 20 seconds. Okay, now keeping your eyes closed, go ahead and touch your nose with one of your right fingers. Okay, now put it down. Now with your left. Okay, now with your right middle finger. Put it down. You can do it with your left pinky. Okay, you can put it down. All right, you may have a seat. So this concludes my musculoskeletal and neurological assessment. Thank you and have a blessed day.